Hi, my name is Arredondo, and I will be doing a Pecha Kucha presentation about electronic aspirin and how it is a solution to migraines. I will explain all the details associated with the design and how electronic aspirin is a solution to migraines and chronic headaches. Headaches. A headache is a painful sensation in any part of the body, any part of the part of the head. The pain can range from sharp to dull and may occur with symptoms. The most common types of headaches are TMJs, clusters, tension, migraine, sinus, and neck headaches. Migraines. A migraine is a type of headache that varies with intensity. It can be accompanied by nausea and sensitivity to a light and sound. They can be preceded by warning symptoms called triggers. Some triggers include hormonal changes, certain foods, drinks, and stress and exercise. The problem. Do you know that chronic headaches and migraines are extremely common? They affect 45 million Americans. Chronic pain can significantly affect one's quality of life, sometimes having to avoid certain activities and, and food that may increase the pain. Electronic aspirin is a medical technology approved by the FDA. It helps patients relieve pain such as chronic headaches, migraines, and or facial pain. With a standard aspirin tablet isn't effective for when you take two aspirins and calming the morning method is useless. Statistics. In average, there are 2 million migraine attacks that happen every day. In the graph, you can see that the migraines affect quality of life, workplace, and or school, where sufferers all around the world are missing or having to leave early or getting there late. Medical professionals have long associated with long severe chronic forms of headaches with facial bundles known as SPG, but haven't yet found the treatment that works with the SPG for long term. Location. The main nerve that causes migraines is the SPG. It is located just between the eye and the ear, around the start of the jawbone. You can refer to the picture and accurately see where it is located. It is located around right here, right around where the jawbone meets the face. SPG is a collection of nerves that are closely associated with the trigeminal nerve, which is mainly involved with headaches, disorders, and certain autonomic nerves and sensory nerves. In the SPG, the autonomic nerves supply the largic glands which produce tears and inner lining of the nose. Autonomic nerves are specialized nerves that control organ function, including gut and bladder movements, beating of the heart, sweating, salivation, tearing, and other secretions, such as stomach, lungs, heart, liver. Sensory nerves. Sensory nerves are nerves that can transmit sensory information such as sight, sound, feeling, etc. They are activated by sensory inputs and send projections to other elements of the nervous system, ultimately conveying sensory information to the brain or spinal sections. SPG is associated with the headaches, migraines, in many cases common aspirin tablets, and effective to treating this pain as there is no treatment found by working against SPG so far found. Electronic aspirin. The electronic aspirin is an implant that helps chronic pain migraine patients and severe headaches without taking any medicine every day. Atomic Technologies is the institution that created the device, and it has recently been approved by FDA approval. The technology, the pointed tip on the implant connected with the SPG bundle, and during the onset of the headaches, the patient is able to place the handheld remote next to the cheek of the implant in a way that SPG is caused to pain with while becoming stimulated by signal emitted by the device. The system involved to permit is a small stimulating technology that's near the upper gum on the side of the head that the patient is most affected or has headaches by. The procedure takes about 2 to 3 hours. The solution. In certain clinical trials, people who suffer chronic headaches upon using electronic aspirin, 68% reported improvement. But have by having this device, patients have had a large who don't have to take large doses of aspirin. Aspirin can increase the amount of bleeding and stomach from your stomach and intestines. This device is consumer friendly. It is used by the consumer. It connects the stem to the SPG and is able to remotely control the device so that when you have a large amount of pain coming through, you're able to stop it. The electronic aspirin is a patient-powered tool. The device works primarily by enabling patients to interface with the SPG signals on the onset stage of the headache. In having such a device, the medical field is able to open up its possibilities so that you're no longer able to take harmful medicine. In conclusion, if you suffer from chronic headaches or migraines, there is hope. You no longer need to just take medication and pray that it works. No longer are there those major side effects that make you dizzy, give you headaches. If you have any questions, I can't really answer them, but you can look up these websites I just left right here. If you have any other questions about those things, you can email me at adam_arredondo at 625 at yahoo.com or my school email, and I will be happily able to help you through any questions you have. Thank you very much. Have a great day.